Good day, everyone. Today, our group will be presenting on phenylketonuria, also known as PKU. This is a rare but serious inherited disorder that, if it's undiagnosed, can lead to severe neurological problems. Our focus today will be on understanding the disease and highlighting the critical issues of diagnostic delays. I'm Vaishnavi Thiruselvam, and these are my group members. We worked together to prepare this presentation. Each of us contributed different sections to cover this important topic comprehensively. So, what is exactly PKU? PKU is a genetic disorder that affects the body's ability to break down an essential amino acid called phenylalanine, which we usually get from protein containing foods. The root cause is a mutation in the PAH gene, which provides instruction to produce the enzyme phenylalanine hydrolase. Without enough of this enzyme, phenylalanine accumulates in the blood. If left unmanaged, this buildup crosses into the brain and can cause severe neurological damage, including intellectual disability, development delays, and other cognitive impairments. Next up, let's move on for the prevalence and consequences. PKU is considered a rare disease, but its prevalence varies globally. For an example, regions like Europe, the US, and parts of Middle East, especially populations with higher rates of consanguinity, show a great prevalence. In countries like Malaysia, PKU remains underdiagnosed, making a widespread newborn screening and early detection critical. Without timely intervention, individuals with PKU face risks like intellectual disabilities, seizures, and even skin disorder, all of which are largely preventable with early management. Next up, the critical challenge. One of the biggest hurdles we face with PKU diagnostic delays, which has devastating consequences. Let's look at why this happens. First, many countries lack of universal newborn screening, missing that vital window for early detection. Even where screening exists, access to advanced genetic tests like next generation sequencing remain limited, especially in developing
Hi everyone, my name is
regions.
Jennifer, and
There
today
are
I will be
also
talking about the
cases of
profound
slow lab
impact of
processing
untreated
or
PKU.
poor
Alright, so
follow-up
let's start by
system,
looking at why
adding to
untreated
delays.
PKU is such a
The
big deal, not just for the person
PAH
who is
genes
diagnosed,
itself
but
highly
also for
complex
families and
with
the healthcare
numerous
system as a whole.
variants, making
So when
diagnosis
PKU
even
isn't
more
diagnosed or
challenging. And
managed
sadly,
properly, it often leads to
every delay
cognitive
increases
impairment,
the
and
risk
this
of
can be anything from mild learning
irreversible
difficulties all the way to severe intellectual
neurological
disability,
damage
which
with
obviously has a
lifelong
huge
impacts
impact
on
on a child's
individual's family.
education and their
Therefore,
ability to live
addressing these
independently later on. But
barriers
it doesn't really
is
stop
not
there
just a
because
medical
families also go
necessity,
through a lot of
it's a
emotional stress,
public
having to cope
health
with
priority.
developmental delays, strict lifelong dietary restrictions, and just the uncertainty of it all. And on a bigger scale, the long-term cost of supporting someone with severe neurological impairment can really put a strain on public healthcare systems, as
Moving
pointed
on,
out
let's
by
talk about
the
what can
research
actually
that
be
has
done
been
at the
done.
system
So
level to
overall,
manage
it is
PKU
not
better.
just about
First, we
managing
need to
one
have
medical
mandatory
condition;
newborn
it's
screening.
about
Using
preventing a
mass
facade of
spectrometry, babies
challenges
can be
that
screened within the
affect
first 48
patients,
to 72
families, and
hours
the
of life,
society as a
catching
whole.
PKU before the symptoms even appear. We also need public subsidies and support to cover the cost of special medical formulas, ongoing tests, and dietary counseling because these things can get really expensive. Setting up regional genetic testing centers would help families get timely and more accurate diagnosis, especially when it comes to analyzing PAH gene variants. Another step would be creating a national PKU registry that connects with electronic health records. This would help healthcare providers keep track of patient progress and coordinate care better. And finally, training healthcare staff so that the doctors, nurses, and dietitians are confident and up to date when it comes Now
to
let's take a look at
diagnosing,
how technology can
managing,
take
and counseling
PKU care to
families
the next
affected
level.
by PKU.
First, the use of
When
AI
all these
tools, which can
pieces they
help
come together,
classify
the
creates a
PAH
stronger,
gene
variants
more
quickly and
supportive
more
system that
accurately,
helps
which makes
families
the
right from the
diagnostic
start.
process faster and reduces uncertainty. And then there are mobile health apps, which are very useful for daily life, which lets the families and the caregivers track phenylalanine levels, manage diets, and even set reminders for medication or blood tests. Telemedicine is another game changer, especially for people living far from specialized centers. It gives them the access to expert advice without having to travel long distances. And finally, integrating all of this digital data into public health systems, which makes it easier to share information between clinics, track outcomes, and plan care more effectively. So, by combining all of these tech tools with strong healthcare policies, we can really improve the quality of life for people with PKU and their families.
So, as for the policy frameworks for the PKU advocacy, we need to instill robust policy measures that are essential to ensure comprehensive PKU care. Legally mandating newborn screening ensures that every child receives a timely diagnosis, and public health insurance must cover all aspects of PKU treatment, including lifelong dietary management and specialized formulas to prevent financial hardship for families. Developing national rare disease registries will also enable better data collection, research, and resource allocation. Additionally, incentivizing private healthcare providers to comply with PKU screening and management guidelines that is crucial for a unified national approach. As for fostering community engagement in PKU care, community health workers should train new community health workers to provide education and support to families, especially in remote or underserved communities. And support groups should facilitate and promote supports for caregivers and families, enhancing coping mechanisms and shared experiences, as well as reducing stigma, implementing initiatives to reduce the social stigma associated with PKU, and combat misinformation, fostering a supportive environment.
There's a growing space for entrepreneurial innovation in managing PKU. One strong idea is a digital platform that brings together at home testing and regular phenylalanine tracking. This would make it much easier for patients to monitor their condition from home without relying on frequent hospital visits. If you add AI into the mix for interpreting test results or sending dietary reminders, the platform could offer highly personalized care. It would be useful not only in private clinics but also in public healthcare systems. And since it promotes accessible, consistent care, ventures like this actually support global health goals, especially those focused on improving well being and ensuring equal access for all. Of course, while tech and innovation are important, we also have to consider the ethical side of PKU care. It starts with informed consent, making sure patients fully understand what newborn screening involves and the possible outcomes. Next, there's data privacy. With genetic information involved, strong safeguards are essential to protect families' personal data. Then there's fairness in access. Everyone should have the same chance to benefit from screening and treatment, regardless of income, region, or background. Lastly, reproductive counseling should be respectful, non directive, and emotionally supportive, helping families make choices without pressure or judgment.
Hello everyone. So my name is Bianzhong Yi and I will do the conclusion. Although delayed diagnosis of BKU can lead to avoidable handicap, the outcome has been dramatically improved and by early screening, advances in technology, and robust healthy place. Raising community awareness is still necessary to promote early intervention, and PKU is a globally recognized example how to better treat rare illness due to the fact that it is a rare disease with successful management.